What would happen to your liver if you swapped out ghee with canola oil every single day? A brand new study looked at exactly that. These are two very different types of fats. Ghee is rich in saturated fat. It's often used because it has a very high smoke point when you're cooking. Canola oil, on the other hand, is low in saturated fat, but high in unsaturated fats like monounsaturated fats and polyunsaturated fats. The study recruited 110 participants with diagnosed fatty liver, splitting them into two groups. One group kept eating ghee like usual, and the other replaced it entirely with canola oil. The results were surprising. After just 3 months, those on canola oil saw a significant reduction in liver fat, 84% of them, compared to just 25% of the ghee group. Liver enzymes improved more in the canola oil group too, along with lower LDL cholesterol, triglycerides, and insulin resistance. Weight loss may have had a factor in the results because the canola oil group lost about 4 kilos and the ghee group didn't lose anything. It's unclear if the two groups were truly eating the same number of calories since their intake was self-reported. It is possible that the canola oil itself contributed to the weight loss, or that the participants, they just underreported their food intake. This is just one example of how different fats impact our health, especially when it comes to liver disease and insulin resistance. Now, this raises an important question. Are seed oils like canola oil really as harmful as some claim when it comes to insulin resistance and fatty liver disease? When compared to saturated fat, the body of evidence has a common theme. Let's talk about insulin resistance. Saturated fat, particularly when consumed in a calorie excessive diet, are known to significantly increase liver fat. Insulin resistance is largely a downstream consequence of fat being stored in the wrong places, such as within the muscles and between or within organs like your liver and your pancreas. Let me share with you a meta-analysis over 100 human trials involving more than 4,000 adults, which found that replacing saturated fat with polyunsaturated fat, like those rich in seed oils, significantly improve insulin resistance and subsequently enhance blood glucose control. Diets rich in saturated fat may even reduce insulin sensitivity in the absence of overfeeding. In summary, the evidence shows that when it comes to outcomes like inflammation, cardiovascular disease, insulin resistance, and fatty liver disease, seed oils perform as well or better than saturated fats. I'm not saying to load up on seed oils or eat junk food that's full of them. Those are still calorie-dense, nutrient-poor foods. But for cooking, you're likely better off using canola oil at low heat rather than butter or ghee. Avoid deep frying or using seed oils at very high temperatures, as that may produce harmful compounds. Used properly, seed oils can support better health outcomes.